It wasn't just anxiety. I mean, I remember many masterminds, live coaching sessions where you were laying flat in your hat, really weighed down,
Oh yeah.
depressed,
Oh yeah.
scared. I think there was a point where you thought really wasn't going to get better.
Because a lot of times conventional medicine will tell you there's no end to this. We can't do anything about this. So good luck. And that really put me in a horrible emotional space.
Hey, everybody, welcome today. I'm Maggie Yu MD, functional and holistic medicine physician and owner of Transform Autoimmune. If you haven't joined our Facebook group, I'm going to tell you to go ahead and check out our Facebook group on Facebook called Transform Autoimmune Disease Naturally. I am a functional medicine physician. What is that? That means that I take all of my training and 10 years as a MD practicing in family medicine, and I combine it with some kick-ass functional medicine, natural, holistic, data-driven approach to autoimmunity training and experience as an autoimmune survivor myself over the next 14 years. We're dealing with some mystery, big diagnoses that a lot of people don't know what the heck to do with in the conventional world. We're talking POTS, dysautonomia, IBS, mystery neurological symptoms. So without further ado, Jamie, you're an alumni of a program. You graduated almost over a year ago. So
Yep.
I'd love for you to introduce yourself to our audience.
Sure. I'm Jamie, and I am the queen of mystery illnesses and mystery symptoms where they don't really fit anything in particular, but I know they're there even though nobody else sees them. So yeah, I've been a graduate of this program about a year now, and I am a psychotherapist, 38 years old, living in Southern California with my husband and my kids. About 2 years ago, I just started to develop kind of random neurological symptoms, and that had followed maybe 15 years of GI stuff that was just labeled, IBS, which is just like the garbage where everything goes and they don't know what to do with it, the garbage label. So yeah, I started to get a lot of neurological symptoms, and I just started piling on different symptoms. So yeah, it was the neurological, and then came like really foggy thinking, came the POTS symptoms, which is like I couldn't stand up without my heartbeat going, 140 miles per hour. And I don't know, just a ton of mystery things that I didn't really know what to do with, rashes. Yeah.
Prior to joining the program, what was your biggest frustration with the medical care that you had received to date?
Well, first of all, I didn't get any answers. And so I was left confused. And I also lost a lot of trust in the medical field because I felt like everyone was really dismissive of what I was experiencing. And no one could really lead me in a direction. I was left to kind of research things on my own and take care of myself. And so I just lost a lot of trust that the medical field was there to really help me figure out what was wrong and then help me to heal what was going on with me.
How bad were things a year and a half ago? How much of an impact did this have on your family, your professional life, your financials? How much of an impact did these health symptoms have on you?
Yeah, tremendously. I feel like I was maybe functioning at about 10% of where I would normally be. I couldn't work. I really couldn't parent. My anxiety was out of control, which is not something I'd really had before, but I was even having a lot of like emotional symptoms. I brought a souvenir to kind of show how far I've come. And that is, I lived in this hat. Maggie, do you remember this hat?
I made fun of you. I called it your headache helmet.
Yeah, I had to wear this helmet, 24 hours a day, every day of my life, just to be able to sit upright. And so I had to dig it out of the freezer. I haven't had this thing out in over a year. So it's my little thing I keep just to remind me how far I've come. Yeah, I wasn't functioning at all. Not at all.
What were your results at the end of the 2-month program? Not right now. Let's go back to a year ago. When you ended our program, where were you?
For one, I had no GI symptoms at all, which to me was miraculous because that's something I had for 15 years before I started piling on all the other symptoms. So that was totally gone. I think I was starting to make strides in being able to be more functional as far as like sitting up. My anxiety was way down. My hormones, I think, were starting to get a little bit more, where they needed to be. So I was on my way. I was starting to see progress little by little.
I want to know from your personal experience, what was it about the program that was so different than all the care that you've received prior?
Right. So, first and foremost, I think just knowing that I was going to find a solution, or at least be able to identify what the problems were, and that there was hope to be able to put this back together. That was huge because I hadn't felt hope in a very long time. So that was number one. Number two is, finding out what my linchpins were. That was huge for me. And then you showing how to put those all together to make the system work again.
So, what were your linchpins? I mean, people want to know. They're going to be like, get some nitty gritty detail on. What were some of your linchpins for you, Jamie?
Yeah, well, I think, some the food mapping was helpful. So knowing what I was reacting to food wise, one of my test results was showing that my adrenals were really crazy. And to me, I think that's, a result of how stressed out I was feeling too about my illness. And so being able to address the adrenals, being able to heal those, that was huge for me and calming down everything else.
You've been dealing with IBS for 15 years. So tell me how the food mapping results was very revolutionary for you.
It took a lot of time and effort trying to guess what was aggravating me and what wasn't. And it seemed like different things on different days were okay. And then the next day it wouldn't be okay. And so it was just a lot of effort spent around anxiety about eating. And so the food mapping kind of let me know definitively what was bugging me and what wasn't. And that was very helpful.
Was there any surprises or shockers on your food mapping with the data?
Yeah, I think like baker's yeast. Yeah, that was kind of random for me. Cane sugar, which I'm like, all right, it's not the worst thing that I get rid of that anyway. So
actually, you now know already what that means when you have
I
those two
do.
positive. There's
Yeah.
secret sauce on that one.
Yeah.
Those are false positives, and there's a whole different
Right.
meaning to that.
Right.
Which is like, my gosh, this is like it's like blowing the lid off of this idea that people doctors, and then as a result, their patient, even when doctors are running tests for food allergies or food sensitivities, they don't know what the hell false positives and negatives are when it comes specifically to the autoimmune population, which have way more false positives and negatives.
Mm-hmm.
So there's a lot of misunderstanding out there, misuse of data, money not well spent, and just wrong information that people act on and don't get the results from. What does hormones have to do with IBS or POTS?
Right. So I thought nothing.
How many of you out there think nothing? How many of you think that hormones and adrenals have nothing to do with your autoimmune issues? And how many of you have been told by your doctors that none of that has to do with autoimmune issues? Adrenals? Oh, that's boohoo. Okay. What have you learned?
Everything. They have everything to do with each other. They impact each other greatly. And at first I was a little bit annoyed by that. So I'm like, one more thing is broken, I have to fix. But then I'm like, oh no, this is great. Because if I sort of address one, it affects this one, it affects this. So it all kind of works together either negatively, or if you get it running in a good direction, then they all work together wonderfully.
Just 2 months working with us, no GI symptoms.
Mm-hmm.
Where was your fatigue?
Oh, it was, I would say, probably 75% gone. I mean, it just for a few weeks, that was incredible to me.
People want to know, after 2 months, this is where you're at, but where are you a year later or 2 years later? Where are you a year later?
Yeah, well, I feel like I'm back to where I was before I started adding on all the symptoms, minus the GI symptoms. So I'm kind of better than how I was when I first started getting sick. I feel like I have more energy than I did. I have more kind of clarity about what my body needs to work optimally. My brain is pretty clear. I feel like I've made a few mindset shifts that I needed to make, because that's part of what we did in the program too. That was huge for me. So yeah, I feel like I'm a much better version of myself than I was before. In all ways.
So this is why I say our program is, people are like, oh, it's just 2 months. No, it's 2 months to launch you into a year of autoimmune turnaround, right? Yeah. And what you're saying is right now, currently today, you're better off than you were 15 years ago before you got sick.
Mm-hmm.
That's huge.
Yeah, and I'm getting older too, so that's huge that I'm feeling better now than I did 15 years ago.
What mindset shifts that you have to make that was really crucial to you being here today, where you're at with your health?
Yeah, well, one of the things that I learned through the program is that we tend to fall into one of three categories, and I felt pretty strongly in the people pleaser category. And with that kind of means that I tend to put my own self behind everyone else, right? And so through this program, I had to make a lot of shifts that meant I need to put my own health first, myself first, in order to even be able to love other people well. And so doing that, I learned how to say no to certain things that would stress me out and just care for
Mhm.
myself better. So even just eliminating that stress of saying yes to everything, that even helped my body by calming my adrenals down. And, that did a lot. Not as stressed out. Being able to go back to work has been wonderful. I also take a lot about what I learned with mindset and I can apply it to clients that I see at work. So that's been helpful. Everybody appreciates that, and even some of the worksheets, that we did,
You're still
I
my
can bring those
worksheet?
in. Yeah, I can bring those into sessions, and it creates an almost immediate shift because it's causing you to look at the here and now and how what you're doing now is impacting, your current reality.
I love that. What would you say to somebody out there who's, let's say, on the fence and they're like, I'm just going to go see my 6 other specialists and find another 6 new providers to deal with my 6 different mystery symptoms or autoimmunity?
Yeah.
What would you say to them right now? Because you were there.
Yeah, well, if you want to go ahead and learn the hard way, go for it. Keep seeing all those specialists. But, I feel like I was one of those people that had to learn the hard way, and I wasted a lot of time and a lot of money. So I would say, you've probably been through the ringer, probably been given diagnoses, even medication, and it's not really doing what you wanted it to do, or else you wouldn't be here watching this live, right? If you were doing well. I want to let people know that I'm kind of a walking, talking testament that things can be turned around because I was just really a mess, like really a mess. And I didn't think I was ever going to get out of the hole. And it didn't take too long. I mean, it took a couple months, and here I am, a year out, and I feel as though I'm better than I was before. So I just want to let you know that there really is hope and there's change, that's available to you.
In full disclosure, though, it wasn't just anxiety. I mean, I remember many masterminds, live coaching sessions where you were laying flat in your hat, really weighed down,
Oh, yeah.
depressed,
Oh, yeah.
scared.
Yeah.
And I mean, I would almost say a little hopeless. Like you didn't
Yeah.
think it was actually going to get, I think there was a point where you thought really wasn't going to get better.
I think that if you're in any kind of pain, emotional, physical, whatever, if you know there's an end to it, you can endure it, right? But when you're in that place of just severe suffering and you don't know if this is going to go on forever or not, because a lot of times conventional medicine will tell you there's no end to this. We can't do anything about this. So good luck, and that really put me in a horrible emotional space. And so that's why I was saying that part of this program, what was the most impactful to me the first few weeks was just gaining that hope back, knowing, okay, this is going to be temporary. I don't have to feel like this forever, and
You know,
that was enough for me to get going.
this is why it bugs me. It really actually is like this big. Actually makes me kind of angry when people have fibromyalgia, POTS, dysautonomia, Lyme, whatever, rheumatoid arthritis, and they go to the doctor and the doctor says, well, unless you take this medication or that medication, or if these don't work on you, there's nothing more you can do for you. I
Hmm.
can do for you. And to me, that's just honestly bull.
Yeah.
Because just because and well-meaning doctors, don't get me wrong, but they just haven't been trained in literally hundreds of other tools that functional medicine provider like myself who've gone through autoimmunity is able to teach somebody. So for me, it's like there aren't just 2 options, which is surgery or medication to deal with your hundreds of symptoms. There's literally hundreds of other solutions that can be specifically tailored to you based on your own data.
Hmm.
So for me, it's a disservice as a doctor is concerned, where just because you don't know the other 100 tools doesn't mean that this patient doesn't have tons of other choices. And
Yeah.
it's good to admit that. But the thing is, they can't admit you don't know what you don't know.
Right.
And Maya
Right.
Angelou says, when you know better, you do better. So I get it because I was one of those doctors before I got sick that told people, oh, you're tired. All your labs came back normal. You want an antidepressant?
Yeah.
I was one of those doctors,
Yeah.
which is typical until I got sick. It's almost like we have to get humbled by getting sick ourselves
Yeah.
to then learn that humility and that suffering actually creates the impetus for us to actually get our own education, our own solutions, and then later to share it with others. Okay. Tara Z says, that's so true. Doctors often tell you your condition is progressive or there's no cure. You are the living proof that you can heal. Did you hear that, Jamie?
Yeah, and I got my hope from watching other people before me, kind of give their testimony.
Well, Tara saw
Um,
you in your helmet hat.
yeah, she did. Hi, Tara.
How many of
She
you guys
did.
in the alumni actually saw Jamie in her helmet hat and saw like actually how dire that situation really was? I love the fact that you said you have a list of things that you're going to do.
Yeah.
I'm curious right now, what's something that you've done within the last just month or two that was on that list that you wouldn't have been able to do 2 years ago?
Oh, like amusement parks. Um, I don't know. I took a solo vacation by myself to a winery. That was
Really?
fantastic. Yeah, that was awesome. I don't know. I'm being active. I'm riding bikes. I'm chasing kids around. I'm drinking coffee. I couldn't do that before for some reason, but I'm okay with that now. So
I love it. Well, everybody, thank you so much. Thank you, Jamie, for joining our interview. I
thank
know you got to
you.
be off. You got clients waiting, so I'm going to let you
Yeah.
go. Thank you for joining us.
Okay. Thank you. Bye, guys.
All right, everybody. Thank you so much for joining us. That was Jamie, and she's a perfect example, I think, of answering the question: can mystery illnesses be related to autoimmune? Yes, number one, like POTS, like IBS, like brain fog, like chronic fatigue syndrome. The second question is: can it be turned around working in an online program better, faster, and more effectively? The answer is yes. And then number three, are the results sustainable? And the answer a year later is hell yes. So if you would like to learn more about us, make sure you join our Facebook group, Transform Autoimmune Disease Naturally. You can also in the comment section, we're going to put a link for you to watch our training, the 5 pillars training. You can check out our 5 pillars training to really truly understand the protocol for a root cause approach for autoimmunity. And hey, if you're ready to actually stop this pattern now at the root cause, you're ready to do something now, this interview spoke to you, go ahead and book a call with us. The link is going to be in the comment section, and it's also underneath this video as well. Book a call. You're going to fill out an application just to give us more information so we can figure out if I can help you and also if we're a great fit to work together. So, and you can learn more about how to work with us. So go ahead and book a call. Thank you so much, everybody. Have a great day.